This Cincy Lifestyle Health segment, sponsored by Mercy Health.
Did you ever notice those letters after a caregiver's name, like MD or PA? Well, two healthcare providers at Mercy Health Eastgate Family Medicine explain the difference between a couple of those post-nominals and show us how at Mercy Health you'll receive the same compassionate care whether you're seen by an MD or a PA.
Hi, I'm Dr. Kirsten Brown. I am an internal medicine physician and I work in primary care here at Eastgate Family Medicine. So the primary role of a primary care physician is to kind of treat common conditions, acute illnesses. We also treat chronic illnesses like diabetes, hypertension. We are kind of the go-between between specialists and helping patients navigate kind of the healthcare system as well. And then we do a lot of preventative care and then also do a lot of lifestyle coaching. A lot of complexity happens when patients are seeing a lot of specialists outside of primary care and trying to coordinate all of the different care. So a patient with cancer who's seeing an oncologist that also might have whole body systems affected, kidneys, lungs, trying to make sure that all of the care is coordinated between the different specialists, that nothing's falling through the cracks, and that the patient as a whole is being cared for. I was trained in internal medicine, and so we got a lot of exposure to different specialties in my residency training. So we got exposed to cardiology, pulmonology, nephrology, rheumatology, endocrinology, all the different specialties, as well as primary care. So getting exposure to all the different specialties really helps when specialists are making recommendations, helping explain that to patients, and helping coordinate the care.
My name is Sarah Wilson. I'm a primary care physician assistant at Mercy. In our office here at Eastgate, one of the things I love most about it is we have a variety of different providers. So we have medical doctors, or MDs. We have doctors of osteopathic medicine, or DOs, physician assistants, or PACs, and nurse practitioners that can be APRNs or CNPs. I'm a PAC, certified physician assistant. My job is to see patients, evaluate them, determine a diagnosis, and form a treatment plan. My day-to-day is very varied. So the fun thing about primary care is that you can, anything can walk through the door. So I have my chronic patients that I see is for, chronic disease management, whether that's diabetes, blood pressure, cholesterol, or if someone wakes up that morning and they have a respiratory illness, or they have a weird looking toe, or whatever the case may be, they can call in for an acute visit. And so then I have spaces in my schedule so that I can see acute visits as well. There's a shortage in primary care providers. And so PAs help reduce the wait time for appointments. When we reduce that wait time, we're able to get patients in, get them diagnosed and treated. Those outcomes tend to be better than if someone's waiting for an appointment, or more expensive if they end up in the ER or hospital.
One of the reasons I chose to work for Mercy in particular was the compassionate care that they have for patients, and making sure that patients as a whole are being treated.
Long term, when we develop these relationships, we really can help determine barriers to care for patients and find what really motivates them to be the healthiest versions of themselves. So it's my favorite part.